Jackson Reads this Saturday, as part of Museum Day, you're invited to visit Ella Sharp for Museum Day. They have all kinds of great things going on, and Jackson Reads will be there, and kids can get free books. There are 10 free high-quality books selected for kids from birth to 8th grade, so you'll have, depending on your child's age, a selection of books to take home with you. Meet authors, they'll be there as well. Jackson County Museum Day this Saturday from 10 to 4. Visit your choice of up to 10 museums. Good luck. Map out your route. They're all over Jackson County, and the chance to enjoy our museum's history and art free on Saturday.
We are celebrating Nurses Week, and with us now we have two RNs from the Jackson County Health Department, Matthew Budd and Cindy Wolfinger. Good morning.
Good morning.
Thanks for having us.
Happy Nurses Week.
Thank you.
Thank you.
Yeah, happy Nurses Week, and we also want to mention your mom. Last week, she was introduced as the Teacher of the Year.
Wow.
Yes, very exciting. We're very proud of her.
Does she know it's Nurses Week this week?
You know, I don't know if she does.
Okay, well, let's make
She's a daughter nurse and a daughter-in-law nurse, so
okay.
we'll see what she does.
She might be just so overwhelmed still from the Teacher of the Year award.
Well, it really gives us the time to honor nurses, and really during the pandemic, we saw that, how valuable they are to our community, and for nursing, it's I think a noble profession. It's very giving. People are giving of themselves as a nurse. Matt, what was it about nursing that attracted you?
That's a great question. So right after high school, I became a nurse's aide and worked in long-term care, and I think from that, it was really just kind of a natural progression to learn more about health, well-being, keeping ourselves mobile and healthy, and I was just very interested in that.
And Cindy, how about you?
Yeah, so for a long time I did think I wanted to be a teacher, but then I realized I couldn't deal with that many kids at one time. But I knew I wanted to help someone or help people, and I really enjoyed the sciences. And then when I was in high school, a couple of friends actually ended up with some long-term hospitalizations, and I remember their moms talking about the nurses. And so that kind of inspired me, and so I eventually became a pediatric nurse, so dealt with those kids one-on-one instead of the classroom style.
So you both made it through the pandemic. Did the pandemic make either of you reconsider your profession?
I actually had a transition, and
right.
so during the pandemic.
Right.
So I've had a few different nursing positions, but I was actually at St. Joe's Ann Arbor when the pandemic hit, and I was doing a lot of work with senior citizens and in schools, and I was doing outreach for the trauma program, trying to prevent injuries from occurring in the community, and then the community shut down. So for me, it was really looking at how do I continue to be a nurse and really work on primary prevention. Working at the health department is perfect for that because I can try to prevent illness, try to prevent disease, try to promote health before illness really occurs. And for me as a nursing driver, I started in the ICU and I saw people at their sickest. And I like to prevent as many people as I can from getting to that point.
Yeah.
Well, today's a significant day in the pandemic era.
Very significant day.
Yeah, it's a big day, and it's a happy day. So it's the end of the Public Health Emergency Declaration, the federal declaration that really kick-started off the mobilization of funding, initiatives by CMS, Medicare, Medicaid, and really a lot of the guidance that helped direct the pandemic response over the last couple of years.
So we do have some of those emergency services that are sunsetting, like you said. What should the community be aware of?
So some of the things that might change for us, COVID-19 testing is no longer guaranteed to be free. So that's one of the things that expires with this. So if you have any COVID-19 tests at home, great.
If got not, about 2,000 of them.
I have a whole box.
Yeah. That's one of the big changes. There's going to be some changes potentially for like out-of-network paying for vaccines and things, but vaccines are still eligible. Your insurance should cover them in network, and I think any changes will be later. The big changes really came with like Medicaid eligibility, and I think a lot of people on Medicaid should have already received messaging from the state letting them know how to reapply and ensure that they're continuing to be eligible. But a lot of the changes for the things that we're doing in our community really stay the same. The guidance is the same. The CDC still recognizes COVID-19 as a public health threat, but we are having less and less people die each day from COVID-19 in the country, still about 1,000 deaths in the US per week. But that's down from several months ago where it was about 1,000 a day. So, looking at last year.
Right.
So with that in mind, we're still monitoring, but not quite monitoring as strictly. We need to start looking at other healthcare elements and factors in the community to see what else we could be doing as public health.
Yeah, public health, that's your focus. Deputy Health Officer, and Cindy, your public health nurse. What's your day-to-day like? What kinds of things is part of your job?
Yeah, so I review all of the infant deaths for the county. So I look at everything I possibly can related to that death, related to the pregnancy, just to see what could we have maybe done better as a community that would have potentially prevented that death and will hopefully prevent future deaths. So I take all the information I find, de-identify it, and then present it to a case review team that I lead, and they're the ones that really help me kind of point out and figure out what can we do and what can we change. So with that, I do a lot of infant safe sleep education as well, because that is one of our leading cause of deaths, as you guys probably remember from October. So lots of kind of digging into charts, computer work, and then a lot of education out in the community as well.
Cool.
So you're able to, with this data, draw some conclusions, and our community has had not the greatest record in terms of infant and maternal health. What are your conclusions?
I mean, unfortunately, a lot of our deaths are prematurity related, and those aren't always preventable. But a lot of times we see better outcomes if we can get moms into care earlier on in their pregnancies. And then also, if there are more community resources, a lot of these moms either don't have a ride to these doctor's appointments, they don't have insurance, they don't know how to get insurance. So just making sure that we have people there to support those families.
So are you having basically pregnant mothers kind of skip certain steps? Yeah.
Yeah, and it's hard because pregnancy has a lot of doctor's appointments, so getting to all of those is a struggle.
For sure, for sure, yeah.
And getting it scheduled around work too, so
yeah,
it's hard.
Well, and with that, you are a great resource
Yes.
for moms to be, and everyone is eligible to access all of
just
your
pick up the
services.
phone.
Yeah.
Do you guys answer any questions?
Yeah.
We answer a lot of questions,
Yes.
but we do have a lot of services for not only infants, but pregnant moms as well. Or I should probably say that backwards. We have a lot of services for pregnant moms and also infants that are here with us. Through WIC and maternal infant health and children's special health care services, and so we have a lot of services available.
Now, are you, as a administrator, are you less hands-on in nursing now?
I am. I did give a vaccine during the pandemic, so that felt pretty good to still be able to kind of keep some of my skills alive.
Just one?
Just one, actually.
That's hilarious.
But I gotta put in the effort when I can.
Yes.
But yeah, it does mean I'm a bit more behind the scenes. I still do get some interaction with clients in the community. I do try to make it out when I can, so that I can interact with people. Because of course, if I'm behind a desk all day, what good am I really going to be to identifying what the needs are in the community? So I try to talk with people as much as I can and make sure we're meeting their needs.
Well, we wish you both a happy rest of Nurses Week, and thanks
you.
for all you do in our community. We certainly appreciate it.
Yeah,
Thank
thanks
you.
again. for
Matthew
having us.
Budd and Cindy Wolfinger from the Jackson County Health Department. More of the morning show right after this break.